Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome to the COIQ with Dr. Roxy show. I'm Dr. Roxy, your host from Legacy DNA Marketing Group. Our show is the first of its kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. So let's raise our COIQ. On today's show, we have Ed Bukstel, who commercialized one of the first EHR systems in 1993. And he's going to share with us the lessons that he learned back then and how he's applying those to commercializing his new blockchain venture. Welcome, Ed. Good to have you on the show.
Hey, Dr. Roxy, how you doing? Thank you so much, for inviting me.
Great. So I'm going to start off with going back in time about 25 years ago. Obviously, EHR systems were very uncommon in 1993. So tell us a little bit about what it was like for you to commercialize that EHR system then.
Well, there were, you're 100% right. There was definitely a lot of interest. There were some magazines that you'd wait once a month to get, and it would come in the mail, and they were kind of glossy. And that was the way you found out what was going on as far as this new area of as far as healthcare information systems. There was, I remember going to a HIMSS, and there was only like 5,000 people there, and we thought that was a lot of people. But back in the day, the issues were, and it's actually it was a little bit better because right now the healthcare landscape is so complicated because there's so many different vendors, so many different legacy systems, so much invested. But what was occurring there? It really took a kind of a cultural shift because most of the systems were built for financial purposes exclusively. There was just debits and credits. They were basically called systems for ADT, which meant admit, discharge, transfer. And at the time, very few doctors were even involved in utilizing these systems for clinical purposes, let alone even being involved in the process. It was just basically, folks that were, data folks, the folks that were chief financial officers at the hospitals. The CIO role was really more of a data processing manager. But what happened, I started a company, and we would go around and talk with different companies that, were communicating. Let's say, I contacted laboratory companies that are right now, like LabCorp was a client of mine. Quest used to be it's a combination of SmithKline Laboratories and MedPath Laboratories in New Jersey, and currently. But I had met with folks at MedPath as well as SmithKline. And what was very interesting back in the day, the CIOs of those companies initially said, and doctors don't care about this clinical information. They don't want longitudinal results. Get out of here. We're not going to use this system. So I basically left the offices. I remember it was yesterday. I left the offices kind of dejected, thinking, wow, I spent all this time, going down a rabbit hole, and, all these people at these big companies say nobody's going to want that information about laboratory tests, things of that nature.
Right.
And I thought to myself, that's at the labs, at the hospitals, those are CIOs talking to me. What if I go out and talk to some of the physicians that are out there, and I said, take a look at this system. Here's cumulative reporting, longitudinal tracking, notification for health maintenance reminders, things of that nature. Wouldn't you like to have this in your office? And sure enough, I met with some doctors that said, yeah, we definitely want to have this in our office. How do we do it? So I thought to myself, just tell them to contact the laboratories. And I said, well, we can interface with any of the laboratories that you're working with. You just have to tell them. Now, the dynamic that you have to understand always comes down to a financial dynamic, because many of these doctors were referring tests to these laboratories that would be worth $100,000 a month of revenue to the laboratories. So if a doctor said, look, I want you to interface with Ed's system, all of a sudden the laboratories called me back and said, hey, we understand you met with Dr. Smith or Dr. Jones. We now want to work with you. And those CIOs that said no doctor's interested end up calling me back in their offices, kind of saying, okay, I remember I kicked you out before, but it looks like some big accounts that represent millions of dollars in revenue actually want to work with us or work with your system. So how do we go ahead and interface? So, of course, I said, well, it's going to cost you, of course. So
the price just went up.
Big time. But you have a situation now that it's assumed that people want data, but for whatever reason, that data is still being withheld. And I see the mentality, and no one questions right now, for instance, the idea of having a physician involved in the process of design. The question that comes up, which is very much like the question 25 years ago, that's being asked, is how do we bring the patient involved in the design? Because it's their data, and we've got to get their data to them. We've got to give them better control or better access. I'm not saying ownership, because that gets into a whole set of legal issues that nobody wants to deal with. And I don't think ownership is really that much of it's not a decided issue, because with patients, you can't own 100% of your data. Even if you want to, it sounds nice, but patients are not investing in X-ray machines or analyzers and things of that nature. So a patient should have access to their data as opposed to full ownership.
Yep. So let me ask you a question. That was a pretty unique strategy that you were talking about, going directly to the end user and creating demand up the chain, since the target audience, wasn't getting it or didn't believe that there was an opportunity there. So let me kind of in that same vein, how did you get investors to believe in what you were doing to raise the capital that you needed to commercialize your EHR system back then? Because it was so revolutionary.
Well, we had actually, it was kind of one of those strategies, I guess, if you can't beat them, join them. So one of the laboratories invested $2 million. SmithKline invested $2 million in my company because we were very strategic. If you think about it, they would actually go to doctors' offices and say, I'm using this doctor chart system that Ed designed, and essentially they would use it as a selling tool, and the doctors would say, wow, we get all those longitudinal results. Okay, we'll switch from MetPath or Mayo or the local hospital, and we'll refer more of our business to you. So it was once again a financial dynamic driving a clinical change, a change in viewpoint from the financial to the clinical.
Okay, so then it sounds like SmithKline really understood what you were trying to accomplish, and it was a very strategic investor, not just anybody throwing money your way, but somebody who is actually going to be able to drive adoption.
Absolutely. And one of my other clients was early on, United Health Group was one of the big innovators in information systems, even back in the day, as far as connecting their providers. And they were also a client of mine as well, a pretty significant client. I mean, at one point in time, I think we had close to 8,000 installations from Maine to Maui, and some outside of the U.S., as well as a number of hospitals also, in the Maine to Maui type of footprint.
So you've talked about really two unique strategies, I think, that probably helped you, reach market success. Are there any other decisions that you made around that commercialization process that you think had such a big impact on your success?
I think a fundamental aspect of any of the strategies, then, and I think even today, and today, once again, it's the laser focus is more on the patient and how to get the patient involved in the process. But it really was a new dynamic to bring physicians into the process. And when doctors started telling information system people, we want this, you really have to focus on who your customer is. And the customer in this case was not necessarily the laboratories and the hospitals. They were writing the checks, okay? There's no question about it. But that wasn't the kind of go-to-market strategy. The go-to-market strategy was to, go downstream to the ultimate end users, which were at this point the individual physician offices that referred business to the laboratories and the hospitals. So there was there's definitely a push-pull dynamic. Sometimes the doctors would ask for, special customized reports. Back in the day, that the laboratories would send entire computer systems as part of the strategy, and then all that anti-kickback stuff kicked in, and of course, the Stark laws, try kind of stop that. So some of the computer systems, what would be done, they would bring them in and put them in a physician office and block all functionality of the computer except for being able to do one item, which was utilize our system and receive laboratory results online.
Mm-hmm. So what were some of the obstacles that you had to overcome?
Obstacles? Billion. Yeah, it's like any business. You have the same obstacles that you have today. You have perception. You have inertia. You have people, worried about the not invented here syndrome. People saying, "Oh my God, it's new, therefore we must fear it."
Mm-hmm.
No one wants to. I mean, I don't know how many times people said, "Why do you need a personal computer?" Or why do you need to? No one wants to put anything on the internet. Putting lab results on the internet, is not. It's too. It's not secure enough. It's et cetera. And so every single time, and then people were saying, as tech. There's still healthcare organizations today that have not even adopted the cloud. So, it's obstacles that I face. It's obstacles that that are absolutely out there. Whether it's back in the day or today, it's the perception issue, the culture. At all points in time, and it doesn't matter how whiz bang and amazing the technology is, culture will trump technology every single time. And that's it. If you don't have something that makes things a little bit better for the people that are going to use that system, or maybe even there's a perceived use of the system, then you may as well just find another business, because you're going to die a very old, grumpy person, and also probably pretty poor too.
I think that's a great phrase. Culture trumps technology every time. So kind of just continuing on down this path, what advice would you have for other health innovators that are in the trenches right now, that are facing this perception and inertia issue?
I think, and I've really been immersing myself on the blockchain side. You really have to think and understand your use cases and, and how, what the friction points are. Technology for the sake of technology is not going to make a situation better. There's a lot of other considerations that show up, and we need to be cognizant of those considerations. You really need to study the market. You need to see how people are using the systems. I would say also there's always this. People want to add features and customizations and capabilities. And you know what? You may not need all that feature creep when you create a package. It might be as simple as just taking an image and extracting data and not worrying about a bunch of other phenomenal features. I mean, think about it. We use Microsoft Word most of the time. There's like a zillion capabilities there that we really never use. But Microsoft was able to build that zillion capabilities into the product because they had a lot of money to do it. Right. As a small company, we can't build all those awesome features. We've got to focus on the ones that make sense. And going forward, if you don't do that, like I said, you're going to be roadkill.
Yeah, that's so true, Ed. A lot of the innovators and entrepreneurs that we speak to are really talking about that same thing. Sometimes I see that they overdevelop the product so much, but they don't even have any money left to actually go to market. And so that just can sabotage their success right there.
We must be talking to some of the same people, because it can become a wasteland. And then people just develop things that just don't make sense. We talked a little bit about blockchain and some of the what's occurring right now, with the excitement, the hype. I think people are finally getting to the valley of despair, because the hype was really high, and you've got 95% of the 140 plus healthcare related ICOs that say they use blockchain are off by 93% or more as far as their valuations from their ICO. So the bottom line learning thing. I mean, literally, that's 140. Just an incredible amount of a group of companies that all thought they had, or many of them thought they had great ideas, but fundamentally they were trying to tokenize healthcare. And I think one of the things people need to realize is, that type of script has been tried many, many times, and it's failed. You can't tokenize healthcare. If a patient has to pay a bill for a $1,500 medical bill, they're not going to care whether or not they get a token that allows them to buy some Nike gear or, get an Amazon discount for $25 if they're facing a $1,500 or $2,000 or $5,000 bill. I mean, it just absolutely boggles the mind how some smart people could fall into some really delusional business cases.
Yeah. Absolutely. So we both have kind of tossed around the phrase or the term blockchain quite a bit. And so for those of our listeners that don't really understand blockchain or know what that means, help us explain that in its most simplest form. What is blockchain?
Blockchain is a technology that because of the nature of its decentralization and because of the architecture as to creating what are called blocks that are linked together and that are also cryptographically secure, it is a mechanism that allows trust to be built. And that trust component is actually built by virtue of a consensus mechanism that allows decentralized groups to all agree that something may be true. So the issues, and without getting into the weeds on the technology aspect, because that is really not necessarily for the average person. And the people that are going to actually interact with the technology,
right?
It's really not as important. I mean, for instance, when we're talking right now, we're on this discussion. I'm not sitting here saying, "Wow, this is through a TCP/IP connection, and we've got a secure server, and here's this is the IP protocol that we're using, or whatever the case may be." We don't care because it works.
Right.
Blockchain is kind of that. It will be at that same level. In fact, the best blockchain applications and capabilities that will be out there will be the ones probably where users have no idea that blockchain has been utilized. They'll just realize, wow, this information seems a heck of a lot more precise than what it used to be. I mean, I don't know if you remember, when they had different browsers out there and search engines, and you get all these ridiculous search results, before Google really had their stuff. I mean, yep. You would do searches, and the first things that would come up would be, advertisements, porn sites, all kinds of things. It was almost non-usable. Search was almost non-usable until Google came up with, their algorithms. Now, I relate that to blockchain. We're going to find out, I believe, that there are some features and functions with blockchain that that no one has really thought about yet or actually implemented yet. And our experiences, I think, for the most part, are going to be much higher from a user level. I mean, I've used the example before. Steve Jobs, when he created the iPhone, he had no idea that Uber or Airbnb were going to be created. He wasn't thinking about them. He was thinking about a device that was could form a platform for other functions and capabilities, which obviously those business cases came to fruition and continue to. And today we're in the same type of situation. We're still looking for the business cases that are going to propel blockchain and the user experience forward.
So Ed, what is the number one or the most important friction point that, you as the founder and leader at Clinical Blockchain what is it that you're solving, that most important friction point or problem?
There's a couple of them. The most important there's two, I would say, that the end user. I'm going to take one step back. The most important friction point that I'm dealing with today, whether it's in the life sciences and pharma space or helping enhance patient experience, is the situation of the digitalization of records. The fact that the fax machine is still responsible for about 75% of all healthcare communications, outside a hospital setting, in the ambulatory setting, and that's a fact that boggles the mind, and the ability to onboard that proliferation, as well as the situation that fax machine. We have to recognize that's the truth, and we can't avoid that situation. So let's go ahead and take that and extract out of that whatever we can, even if it's recognizing, hey, that fax machines are an on-ramp. Let's go ahead and get that information, as well as PDFs, all aligned into at least an identity. And that identity is one of the items that we also address in clinical blockchain.
So Ed, help us understand, kind of just going a little bit more personal and deeper here into like the psychology of an entrepreneur, right? So there's all of the strategies, tactics associated with the commercialization process that are like really tangible, right? The launch stuff, the marketing, messaging, branding, all that stuff that, we kind of know. But there's also a major factor, the mindset of the entrepreneur. So kind of help us understand either what that was like for you when you were commercializing the EHR system in 1993, or, the venture that you're doing right now with Clinical Blockchain. How are you, every entrepreneur faces challenges, obstacles, nose, door shut. How are you overcoming that?
Hey, I've even had monitors thrown out of 4-story windows going right through the. See, today these LEDs, you can't really break a window when you get mad and throw it out. But there literally was. I remember our landlord came up and said, "Oh my gosh, they thought there was a break-in," and then I think the landlord realized that all of the glass was out. Bottom line is, you're going to be frustrated. Yep. You're going to hear no a lot. Okay, it's going to cause you possibly to just question everything that you believe in, and every so often there's something that lights your fire, and you got to stay passionate. Sometimes it may be hard to do, but
right.
If you believe in it, and then you find you surround yourself with the right people that know what they're talking about, and you got to respect opinions of others. Frankly, you got to respect opinions of others. Even if sometimes you want to say right off the bat, I really shouldn't have to respect your opinion because it doesn't make sense. But you know what? You still have to respect it, because every so often there's a nugget that comes out that's like, wow, I did not expect that groundbreaking type of alert to come out of you, but it happens. It's and you have to wake up every day. Some days it's a little bit tougher. You're like, oh, geez, I got to do this again. And you got to put yourself out there. I've gone to these, I make a point to go to these meetups in Philadelphia, whether the Ethereum blockchain meetup, or there's a Philly blockchain technology in Philly. I was just involved in working to plan some events for Philly Tech Week. And, even yesterday I went to a meetup, and they were doing a decentralization of the creation of tulips. And in a gamified format, and they were representing this information on a blockchain. A company called Telex, some real smart people talking about, how are we going to go ahead and trade and share and work together in in the digital realm? And they add this gamification portion to it, which I just thought was absolutely brilliant. Actually, and one of the guys, the developers, was talking with him. He had Buzz Lightyear earrings on, but absolutely creative. And it got me to thinking, how could a technology like that and that type of gamification or that type of thought process potentially help in healthcare? And there's definite areas. I think the future is incorporating some type of blockchain and some type of gamification schema into patient interactions, provider interactions, and interactions amongst other people that you don't even think about right now.
Mm-hmm, mm-hmm. So earlier you were talking about the inertia and the culture of healthcare, and it's obvious that healthcare moves slower than most other industries. And you also talked about how it's really oversaturated with an explosion of innovation. So anybody that's part of the target market, there have people calling them, texting, knocking on the doors, saying my widget's going to change your life, right? So what are some of the strategies that you have to be able to rise above the noise and get the attention of your target audience?
Yeah, you're right. The noise level is at freakish proportions right now, and trying to get above the noise is important. But even that noise, you have to recognize. Mm-hmm. Is there even an audience? And I'm referring to blockchain specifically. For instance, what are the motivations? Why would an information systems officer, a CIO at a hospital, want blockchain in their institution? First of all, I don't think there's a business model even that can be created for CIOs to say, yeah, you know what, go to the board and say, we want to go ahead and build this infrastructure, and once it's built out, all of our patients can share all their information with our competitors. Any board of directors is going to basically say, you want to do what, and you want to spend our money to, and I would say there are some forward-thinking groups out there that may be willing to take that type of risk to go forward. I think of Jefferson Health System here in Philadelphia. They're very attuned to trying making the community and the zip codes around Philadelphia much healthier, even if it means sacrificing a little bit of business opportunity. But recognizing that what the motivations may be. We can't go in, and it almost makes me laugh when I see some of these companies and ICOs that, and people that are talking to me saying, we want to launch an application, we're going to sell to physicians. And they don't realize that 400 physicians killed themselves last year, and one of the number one stressors saying as to why they killed themselves was that they had to play with information systems. So, depression amongst healthcare providers and clinicians is at epic proportions. Yeah. So if you could go in there and say, hey guys, I got this new thing, man, it's whiz bang and it runs on blockchain, it's going to, and they're going to be saying, just get the heck out of my office, because, they're already stressed out. And the last thing someone wants to hear about is another type of product that's going to save the day. Now, one of the things that you mentioned, which is the key point, and it comes back around, is okay, but maybe can it help solve a friction point that these folks have to deal with? And for instance, helping to smooth the workflow with from the fax machine integration, or just being able to help a patient collect their records onto a single identity instead of having records all over the place. That might help. And if you can go into the physician's office and say, instead you say, Doc, I have all of my information here. Would you like to go ahead and take a look at that? It's a situation where, it looks like the patient already went ahead and did all that homework, all that, gathering of their data. And all we did, from clinical blockchain's perspective, is to help them connect that information. And we're not going in and saying to the doctors, we're going to change your lives or practices for the better, because, frankly, that's not the friction point right now are the information systems
Right.
that doctors have to deal with, and unfortunately, the inertia is there. I've said, before, I said it again. You've got these epics and cerners and groups out there, and someone once told me that one of the reasons why God was able to create the world in 7 days or 6 days was because he was working from a blank slate. He didn't have any legacy systems that he had to deal with, or she had to deal with. My daughters would definitely correct me on the she thing. Daddy, God is a woman. I said, yes, she is. But yeah, the bottom line is that we have to, recognize that we do have all that noise that we have to deal with, and that noise, sometimes that noise creates some, really ridiculous circumstances. But like I said, when you wake up in the morning, you go out there and make sure you're passionate about what you're doing, and put yourself out there.
Yeah.
I don't know if I answered your question. That was a long-winded answer. Wow. Hey, Simon, you still there?
No worries at all. So we're kind of talking about these two paths that you've taken, where you've commercialized the EHR system in 1993. Now you're out going to market for the clinical blockchain venture. What's one thing that maybe you've done in the past that you're doing different in this new go-to-market strategy for clinical blockchain?
I think I've opened up a lot more. I've said to my investors, I've said, look, we have, things are open source. You have to share, you have to decide, you literally have to have as part of a business case, how you're going to go ahead and create a community. Now, if you go ahead and you're not going to create a community if you just say, look, I'm going to go ahead and build this product, and I want everybody to work with it. You have to go ahead and give a little bit. And when I say give, it might be making sure that certain source code is available on GitHub, or there's you're helping develop and share. So I think people are much more open about intellectual property. We're not necessarily like the absolute secrets and technologies that you're planning on working with, but
right.
You're the ability to open up and in our connected world and Skype with India, Romania, Estonia, or wherever, and connect. You don't know all the people that are out there that may want to help you if you go ahead and provide just a little bit of help that makes that engagement a little bit easier to go with. So I think I've definitely opened up a bit, in the way I look at things. Definitely a bit less critical about what other people are doing. I mean, heck, I've had a meeting with people making tulips, and I'm putting it on a blockchain, and I started as they're making the tulips and creating the colors with different 360-degree view. I'm thinking about the 360-degree view of the patient and how you could try and maximize interactions and create, just like they were trying to create the perfect tulip. I'm thinking about creating the perfect health experience. So those things, and the mat or the image that they were creating was. It looked like a new interface possibly. It's just, you have to be open and question just about everything you're thinking about, even if it hurts.
So the last question that I have for you, Ed, before we wrap up this part of the interview and go ahead and open up to the Q&A session, is what do you think is the biggest driver of success when commercializing a healthcare innovation today?
The biggest driver or influence
for an entrepreneur or for a founder, innovator like yourself, what do you think the biggest driver is for success?
It's this is old school, but it's you got to show up. If you don't show up and don't show, and you got to show up even at events. You got to show up at locations. You've got to go ahead and show up on a digital realm as well. You've got to be, I've got about on LinkedIn, about 25,000 folks that, follow me. I participate in tweet chats, with some different communities. There's, that's it. I mean, you're 100. If you don't show up, you are guaranteed. There's one thing you're guaranteed: 100% of the time, if you don't show up, 100% of the time you will fail. And that's it. And after that, hopefully, it's something that it's going to make you money. But it's you want to in this environment, you want to help people out and be a little bit more open to that process.
All right. Well, thank you, Ed. So we're just going to pause right here. If you want to find out more about clinical blockchain or watch more episodes of our show, head to our video show page at drroxy.com. And of course, if you would like to tell us your story, go to the Be My Guest page on the Dr. Roxy website and apply. We'd love to hear about your healthcare innovation experience. And thanks so much for watching the show. You can subscribe to our program from our YouTube channel at COIQ with Dr. Roxy. Until next time, let's raise our COIQ. What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.